Between 2023 and 2024, almost 5,000 British Columbians received treatment from substance use support beds across all of BC's health authorities. But what about those who did not, because there was not a detox bed available, or because lifestyle, cultural, or other limitations prevented them from being able to participate in inpatient detox? My next guest, Neil Arao, is an executive director with Options Community Services. He's going to talk to us about the Home Detox program, a life-saving program that is in jeopardy of ending at the end of March. I won't describe it, I won't speak further. Instead, I'll start by letting those who have participated, clients of the Home Detox program, speak. And then I welcome Neil Arao to Rachel Thexton Connects.
Hello, I've been the recent recipient of the Home Detox program, and I've found it to be incredibly helpful. The staff, the people were incredibly supportive and kind, and I feel that I'm well on my way to recovery, and it's completely because of them. I thank them very much, and I hope that they will be able to continue their good work.
I'm a 63-year-old South Asian woman, and I have had a very difficult time finding a program that suits my needs. For some time, I have tried a number of programs, and when I came upon Options just a little over a month ago, I cannot begin to tell you what it has meant to me. Feeling better than I have in a long time. The program has given me my life back. The staff are amazing. They are compassionate, intelligent. They are not condescending. They are very open to listening, and their advice or feedback is always welcome and delivered in such a manner that you are seen as a person. I am hopeful that this program will continue. To me, it has been a lifeline.
Okay, so today on the podcast, I'm honored to have a guest that I have the privilege of working with in my everyday PR business. Neil Arao is the Executive Director, Homelessness, Housing, and Mental Health Services with Options Community Services. Neil, thanks for being on the podcast today. I appreciate you joining me.
Yeah, thanks for having me, Rachel. This is great.
Of course. So I have worked with Options now for 2 or 3 years. Fantastic nonprofit organization based in Surrey, servicing various communities in Greater Vancouver. And Neil is an executive director there, as I mentioned, and there's a program that him and his team launched very successfully, which I would love to chat about. But before we do that, Neil, I'd love to just kind of learn a little bit more about you and your journey into working in nonprofits, specifically supporting community members in the housing, mental health, and substance use space. So is this something that you've always wanted to do? And can you tell us a little bit about that journey to where you are today as executive director?
Yeah, sure. My work in this field started probably around 2007, where I started working with a nonprofit as an A&D counselor. And from there, I was fortunate enough to get to complete my bachelor's of social work, and I had a really great mentor who also helped me get a practicum at Vancouver Detox over in Vancouver Coastal Health. And from there, once my foot was in the door, I kind of worked my way around the health authority, working on the ACT teams, taking leadership positions. I kind of completing my master's of social work and moving into managing the inner city mental health substance use portfolio. And then from there, I moved over to the Provincial Health Services Authority, managing the intensive psychosocial rehab and pre-discharge units at the Forensic Psychiatric Hospital. And that eventually led me to my current role as Executive Director at Options Community Services. And it definitely was not my original plan. I wanted to be a motorcycle or aircraft mechanic, or maybe even follow my dad's footsteps and get into avionics. But My journey took a turn when I started to learn about social justice, thanks to a friend in the field. And that curiosity just pushed me towards social work and shaped my belief that, at the end of the day, everyone's just trying to be happy. And, if someone's struggling to get there, why wouldn't we lend a hand? And that's been the foundation of my work. And that's why programs like Home Detox matter, because they help people recover, but also allow them to heal in a way that just makes sense for them.
Yeah, this episode and the reason I asked you to join me on the podcast is focused on this vital support of the Home Detox program that you're leading over at Options Community Services. Can you tell me, before we discuss that, overall about your work with Options, essentially what you do working in the homelessness, housing, and mental health space?
Yeah, in this portfolio, we have 2 emergency shelters, one in Newton and one in Cloverdale, and 2 transitional housing programs. Our largest housing program is the Thexton Towers, and that's about 420 plus units of supported housing programs. We also operate the emergency weather response shelters in Cloverdale, Delta, and South Surrey. We really have been doing a lot of work within these programs. At Thexton, we partnered with BC Emergency Health Services, and they run a community paramedic clinic at the towers 1 day a week. I think it was the first urban paramedic clinic program, and it's being followed by McMaster University. So originally, they really found a lot of high call volume for 911, and so they partnered with us to pilot this and saw a reduction of almost 40% of 911 calls, and estimated a savings to the healthcare system of approximately $450,000 a year, and that's just running it 1 day a week. And at Thexton Towers, I think we have that full service pharmacy that's also supporting residents who are often barriered or marginalized in accessing businesses in the community. And more recently, we've started to implement a rec program for residents. So we have a gym, we offer laughing yoga, coffee groups, walking groups, all with the intention of building a community there. And on the other side, we have mental health programs, which are also exceptional. So we run the mental health clubhouses in Delta, Surrey, and White Rock, and really great staff who demonstrate true care and compassion with the members there. And they offer groups. They support them with their social, psychological needs. We have 3 assisted living programs as well. Those are your specialized mental health housing programs that are really geared at developing independent living skills for people before they move into the community on their own. Most recent of them, Nickel Place, it's set a really solid standard of what that service should look like. Each person has their own room, staff support. They have programming, social rehabilitation, all with the aim of improving their quality of life. And then we have the outreach teams offering supported living programs for those in the community living with mental health challenges. And they provide outreach to help support, develop, maintain those skills to be able to live independently, accessing resources in the community. And then the successes that we had at Thexton, we cross-pollinated our wellness consultant. So she's working with the assisted living programs to have more intentional focus on reintegration.
Excellent. Wow. In my work with you, Neil, and just hearing a little bit about this, I know the listeners are hearing about these programs, some of them for the first time. I've always found that the programming in which you're leading and the support services are quite innovative in nature. How does that come about? Do you kind of really just look at your surroundings, identify that need, and then, brainstorm with your team and your connections as to how to do something different? I mean, doing PR, I have to be frank with you, is usually quite seamless because these things are actually innovative. And innovative is a buzz term in the PR world because everyone likes to use it, but it doesn't always authentically ring true. But your work is innovative and always incredibly meaningful for the community. So can you just speak a little bit to that? I mean, it's not easy to get these things off the ground and to get them moving.
No, thank you. It's and honestly, a lot of it is working with really creative, brilliant people that I've met along the way, and taking learnings, and I keep those relationships and collaborate with them often. None of these are born out of nothing. I've consulted with a lot of different people around what would work and what wouldn't work. But it's true though. I think working with the health authorities, it's finding yourself in a very bureaucratic system that has specific mandates and targets and operational standards. And the shift towards going to a nonprofit, we're able to flex and be nimble and fill those gaps and identify them much faster than a health authority would or a government ministry. And so we were able to fill that gap and respond very quickly and nimbly, and in a way that we know what's happening in the community, so we can respond very, very appropriately. But I think one of the greatest things that I found, and I've been very fortunate, is working alongside very like-minded people who are able to see an issue and come up with a variety of different approaches to address it. But at the end of the day, it's really connecting with the people that would be impacted and ensuring that it's actually relevant and appropriate for them, and not just another example of that colonial attitude of we've got a solution and you're going to fit this model whether you like it or not, and that's the only option available.
Yeah, no, I like how you describe that. That's a vital piece to this. You can think we have the most brilliant of ideas, but if we're not truly connected with, listening and hearing the needs from those who are experiencing the challenges, the solutions aren't always, aren't always ideal. That leads us into the home detox program, which I've been working on some PR around this program since its launch, and just think it's fantastic. Launched in 2023, funded by Health Canada, and designed to help individuals who qualify to detox from their homes. So, I mean, I am tempted to grab the mic and just say it's wonderful because it does this and this and this and this and this. But can you tell us about the program and why and how the concept evolved for the home detox program?
Yeah. So you're right. We came across a grant opportunity from Health Canada around the substance use and addiction programming. And I was talking to a colleague of mine here who just recently retired, actually, Araujo, who was really instrumental in putting this together. And we talked about the needs in the community. And I had come across a research paper that came out of Fraser Health Authority, and it was outlining the high mortality rates amongst South Asian males due to illicit drugs. And that, many of them, the characteristics and demographics were that they were middle-aged, employed, they had families. However, they had no prior contact to health services. And so the conversation we had was about that South Asian culture and the existing stigma around addiction and substance use issues. So I started to talk to my colleague about my experiences at Vancouver Coastal Health, and I worked with a really sensational nurse, Mary Marlowe, who created the START program there, in which I adapted that model, which allowed individuals to detox in their homes rather than in an inpatient setting. But in this context, we incorporated a culturally safe approach, ensuring that people could maintain that connection to their families, to their faith communities, and the cultural supports while going through withdrawal. As many people in this field kind of have come to learn, people that lead detox return to the same stressors that led them to use in the first place. And so we integrated relapse prevention workers, counseling, medical support into their home environment, and as a result, we've seen better outcomes.
Well, it is amazing. I think that there's. I always say that there's kind of hidden spaces where people are experiencing challenges with substances, and those hidden spaces are often there, I believe, because of the deadly shame and stigmas that go along with substance use. And of course, this is not unique to cultural communities. This is a stigma that is very much prevalent in society everywhere, but clearly within certain cultures, that stigma embodies in different ways and is a different experience for everyone. So South Asian males, I understand that South Asian females have also been benefiting from this program.
Yeah, and it's something that we weren't anticipating or initially expect, but looking at the most recent data that I can draw, 35% of those that have contacted the service have been women. And it's something that in the most recent months, we're seeing an increase in the frequency of women contacting the program. So it's something that's very unique that, I think as a result that we've been really happy to see, but it's unfortunate and we're trying to learn more about why that's happening.
Mm-hmm. And I understand that SFU has been following, kind of studying how the program is going. Is that correct?
Yeah, so we've been fortunate to partner with Dr. Julian Summers and his research team out of SFU. They've put together their completed draft, which has been really amazing to review and see their methodology and the findings that they've come across.
Okay, now for the home detox program, in the, I guess, almost 2 years of delivering this support service to local communities, how have things gone, and what's the feedback been from clients?
Oh, overwhelmingly positive. It's again, there's a lot of kind of things that have happened in it that we never would have anticipated or expected. We've had people from the U.S. travel up to Surrey to be able to access the program and stay with families.
Wow.
We've had requests for people under 19 be able to access the program. There's been an increase for people that don't have supports available that can monitor them through the withdrawal process or that have inadequate housing. So we've developed 2 detox beds in our shelter that they can be supported and supervised by staff 24 hours a day to be able to kind of meet that need. But I think, as far as like some of the research that's come back, it's been really great. I think some of the testimonials that we've received.
Yeah, it's amazing. There's a lot of components about this program that I've understood and thought makes sense, fantastic. This is going to save lives. But one thing that I hadn't thought about before, Neil, to be honest, until chatting about it with you this week, is when you're attending a detox and rehabilitation center, you're being taken out of the everyday stressors and the realities of the real world that we live in. And having personal lived experience myself, well over a decade ago, but still, and having, friends, family, and others who have as well, that is a really difficult situation. You have the supports when you're there, but then when you're back to those stressors, often the supports, aren't really strong enough to keep you feeling as though you can prevent that relapse or that slip, which can send people often back into habits that lead to the shame, and then the cycle returns. So what a huge component of that makes sense. What is the qualification, Neil, for the home detox? So I know you have to qualify medically for this. So what would be the qualification or that would allow someone to be able to detox with the home detox program in their home?
So I think one of the first things is that medically we want to make sure that it's going to be a safe process. So those that have a seizure history, we would consider them to go to an inpatient setting where they can be observed, because we just don't have the resources or capacity, nor expect the families to be able to deal with that should it happen. So no seizure history, untreated DBTs, any untreated any untreated conditions that would otherwise interfere with the process. So untreated psychiatric symptoms. Other than that, the only other kind of piece that we require for alcohol withdrawal is that there is someone available 24 hours a day for the first 3 days minimum to ensure that there's the person's okay, that they can monitor them should anything happen, they can call 911.
Okay. So there is a GP, a doctor, who is with them at their home that comes and goes, a nurse, from what I understand, follow-up care, etc. after the detox period completes. So it really is. Can we talk a bit about the cost savings? Because people say, well, the money isn't really what matters, but at the end of the day, this is something that does matter, because it's how you are able to run a program and how it's to be funded. So can you talk about the savings, how much this program
cost to execute, maybe in comparison to an inpatient treatment or detox?
Yeah, so if we took our average of about 10 people per day that we're supporting, and then dividing it by our budget and looking at what those costs look like, and so that kind of totals approximately $350 per day per client, to be able to support them and go through that process. And that's including, attending groups, the family group support, the relapse prevention workers, the interacting with our physician, nursing support, med administration. So all of that is kind of wrapped into that. And comparatively, as far as what I understand, an inpatient detox bed is approximately $1,100 per day per person. So, from the outset, there's almost that $800 difference savings per day per person.
Wow. Huge cost savings. So that's definitely a factor. Detox beds are hard to secure. If you are able to secure one, there's obviously those barriers in which we've talked about that some people just simply cannot do the inpatient structure for various reasons. Is the home detox model something that is prevalent and used widely across the province, or is this unique?
So Vancouver Coastal Health operates their START program. Interior Health is operating a home detox program as well. And they've actually contacted us because they want to compare notes about what's been working for them as well and see what our learnings have been. But as far as I am aware of and what I understand, those are the only other two areas that are providing a home detox alternative.
Okay, so it seems as though it's this program and the model is underutilized in BC and likely across Canada.
Yeah, absolutely. And from what we're able to tell, you hinted at this earlier, that there's a huge wait list to get into detox, and a large number of those people don't require an inpatient setting, and that can really be diverted to be done at home and free up those beds for those that really need them, right? And so it's really advantageous to be able to, for those two approaches to work together and not really, operate independently and silo of each other.
Yeah, for sure. Just before we get to where the program is right now, I just wanted to, note one thing that I think is key here is when someone makes that decision, and they really do have to make that decision for themselves, that they would like to stop using substances and detox. That is a moment when I believe there absolutely needs to be an option available to them quickly. So, if they seek that support and there is a long wait, there is a chance that they, will continue to use and change their mind, right? And we know the illicit market has very dangerous and deadly supply that has taken thousands and thousands of lives across our nation. So having, quicker access to these types of detox and support programs, I think is life-saving and absolutely vital. So I'll jump off my soapbox now and head back to where we are with this program. So the funding, Neil, from what I understand, ends at the end of March 31st. So where are we? What happens on March 31st? And what is the next step in efforts to keep this important program running?
We managed to reduce our budget from the original cost by 20%. And we've also secured a grant to be able to pay for a third of it, but we're still short $550,000 a year to be able to operate it. So we've reached out to Health Canada, back to the SUOP program, to see if there's additional dollars that they'd be able to put or reinvest. We've reached out to the Health Authority, to the Provincial Minister of Health, even private donors. And so far, we're still waiting to hear back from many of them. Staff are, obviously feeling anxious, and clients are asking how they can help to be able to keep that service alive. But we're not giving up. We know this program works. We're actively looking for every possible funding avenue.
Okay. And what can people do if they want to either donate funds, if an organization or a corporation wants to speak with you about funding, or just anything at all to support the continuation of this program, which absolutely, in my opinion, needs to continue the Options Community Services Home Detox program.
Yeah, please visit our website at www.options.bc.ca. There's a donate button there. We also have some other really great programs that we provide, so it'd be a great opportunity to learn more about what we do. You can also voice your support by emailing the BC's Minister of Health, Josie Osborne, at hlth.minister@gov.bc.ca. Every dollar and every message of support helps.
Okay, great. Neil, I'll link to the website and to the email for Josie Osborne below this episode, as well as information on the Home Detox program. Neil Arao, Executive Director, Homelessness, Housing and Mental Health Services with Options Community Services. Thank you so much for being here, Neil. The Home Detox program is, whenever we see one of our fantastic leaders speak to the need for more detox beds, the need for more support, whenever we hear a parent speak to the devastation of losing a child or a loved one, this right here is exactly an example of the type of support that those wanting to detox and recover from substance use need. And we cannot let this program go. So I thank you so much for coming on. Thank you so much for the work that you do, Neil. It's so important to our community, and your team is just fantastic. Thanks.
Great. Thanks so much, Rachel. Be kind and truly connect. You're listening to Rachel Thexton Connects.